Dear friends, dear colleague, welcome back to the Center of Digital Dentistry, to the Mangano Digital Academy. In this video of the done phase, we talk about, for the first time, we talk about artificial intelligence. Artificial intelligence is a very valuable tool for digital dentists all over the world. It's a novel tool, very promising, and it is already extremely helpful to change our profession, to save time and to work in a very predictable way. But before to talk about artificial intelligence, let's go back a little bit to the workflow and to the path of digital dentistry. We have a scan phase for data acquisition, which goes from real to virtual thanks to cone-beam computed tomography, intraoral phase scanner, digital condylography. Then after we have acquired all data three-dimensionally of our patient, we have our virtual patient, we can make our plan. So we can elaborate data by means of software. We have software for prosto, software for ortho, software for surgery. Then we can go from virtual to real to the production, so the making, the shaping phase, shaping for milling units, making for 3D printer or SLS, SLM technologies for the metals. And then we can finally clinically apply what we have produced along this path. So the clinical application, the delivery of the restoration, the use of the surgical guide, the delivery of the orthodontic retainer, aligner, whatever it is. Let's talk about artificial intelligence now. Artificial intelligence, as I told you, is a relatively novel tool, but it already has a deep impact in the workflow. And I'll show you in this video and in the next video what we can do with this very valuable tool. This is an example of the oldest software available in, it is new, but it has a little bit of history for artificial intelligence. The software name is Diagnocat. We have a cone-beam computed tomography and we want to evaluate the anatomy of this maxilla, of this patient. And we can use the metal artifact reduction algorithm because the CS9600 has several algorithms that then help to reduce, for example, the metal scattering. And we can then save this information, of course, after we have obtained our cross sections, after we have our panoramic curve. We can save and export the DICOM file from this cone-beam computed tomography in different format inside this software, the Diagnocat. So you can upload your CBCT, and after a few minutes, basically, you will have the possibility to upload the full set of DICOM data and to have your assisted diagnosis. This is the first function of this software. How does it work? We have the reproduction of this information, and basically the software provides us an overview of the patient, very useful for an assisted diagnosis. What does it mean? It means that tooth by tooth, the software will be able to recognize if there is an implant, for example, like in the case in the posterior right maxilla, and also if everything goes well with the supporting bone, if everything goes well with the presence or absence of lesion of endodontic origin on the natural teeth, if there is a decay, for example. Obviously the software doesn't work only for 3D. You can upload also other kind of data like a panoramic radiograph, endoral radiograph, periapical radiograph, but now I'm talking about 3D because I'm very interested in cone-beam computed tomography and this specific application. Then you can revise basically tooth by tooth all the suggestions given by the software. And the software gives you a suggestion in terms of percentage. There is a 85% of probability that I have a periodontal problem here or a periapical lesion here. And then you can revise basically all the suggestions given by the software. You can confirm them or eventually modify them if there is a mistake. I have to say that I am using this software since a few months, and very rarely you can find a mistake, even in very complex cone-beam computed tomography, like in the case where a special algorithm for the reduction of the metal article has been uploaded, and also we have several crowns, metal crowns, and with the 3D reproduction is not so easy for the reconstruction software, and is not easy at all for the artificial intelligence. Despite of it, it works very well. Then you can approve step by step, and then you can obtain basically a complete periodontal and endodontic chart in 3D, tooth by tooth, with all the indication. And the software also gives you some suggestion about the possible kind of intervention. For example, you need to treat this tooth endodontically because there's a lesion, or you need to open a flap and treat this periodontal lesion because there's a bone defect here and there. It's really something that is very helpful, and it's called assisted diagnosis. And basically there's a recommendation of consultation. Please, these teeth should be cared by a prosthodontist, by an endodontist, by a periodontologist. It's really something very nice. You can personalize your of course, report with your logo and with all the information, and you can select also different pictures, and it's very useful also for the patient, for the communication to the patient. So we have a radiologic report, full radiologic report, and we have an endodontic analysis, an implant anatomy evaluation. There's a specific mode for the wisdom teeth evaluation, for the surgery of the wisdom teeth, third molar. But another important tool, I think the second very important tool here in this software, is the automated segmentation. It is one of the coolest things here. What does it mean? It means that we can obtain automatically, by means of artificial intelligence, the STL file and the model of the bone and every single tooth in the CBCT with the crown, perfectly, reconstructed. Obviously it depends by the CBCT. In this case, the CBCT was not the best one for this kind of automatic segmentation. Anyway, the software is capable to do that, and you can download all the file in one STL. But I just give you an idea of what you can do with a combine in which there is less metal. Basically, you can have a fast reconstruction and affordable reconstruction of the bone volume and all the single teeth segmented separately and saved in STL. And one of the recent, as you can see, this is how it looks like. It's perfect, and it is entirely radiological, and it's fantastic to have all this information from the CBCT. And each one of these files can be saved outside separately. Can you imagine what you can do with these tools? It's fantastic. You can do, for example, post-extraction implant with custom-made root analog, for example, in zirconia, 3D printed. You can do whatever you want with this tool because it's very reliable, very easy to use, very fast, and it's absolutely cheap. It doesn't cost nothing almost. You pay only some exportation, but it costs little, and it is a very useful tool, as I told you. And one of the new additions of the tool, of the software, will be the possibility to upload an intraoral scan and then to match the intraoral scan with the existing 3D reconstruction of the bone. So everything comes from the radiology. This is the whole appearance of the bone reconstruction, 3D model of the bone, the nerves, the relation of the nerves with the teeth and the teeth themselves. It's very useful for the diagnosis. It's very useful also for the treatment plan. I mentioned only one example, but there are many examples in this case. We can, for example, make a very reliable evaluation of the post-extraction site. After we remove the tooth, we know very well what we can find there, and we can use this tool as a valuable tool for starting our path, or starting our travel, our journey to the guided implant surgery, for example. And why not? Having such a high quality 3D bone model can help a lot during some kind of guided surgery. For example, the guided surgery system I use with AnyReach from the Megagen is the HypnoGuide system, and it is very helpful to use this software Diagnocat to obtain the 3D bone model, particularly when I have to place the implant distally. So this is what you can do. You can simulate the extraction. You can see how the bone will look like after the extraction if you have been gentle with your extraction. You can do a lot of things. So this software opens a new perspective in the field of digital dentistry, and it is something absolutely important to use, important to adopt in your clinics, because it's something that can be considered a game changer once again. And it's one of the first applications of artificial intelligence in dentistry. Thank you very much for your kind attention.